Alex, welcome to Ukrainian Media Center of Reforms, and during our briefing about reforms in Ukraine, this week is dedicated to healthcare. Yesterday we informed you about those basic steps and reforms, and 2309, 10, and 13 about the content, and that it's very important to pass them, and here we can discuss in details those draft laws, and also how the basic steps in healthcare reform with key authors of that reform. And first of all, I would like to invite the Minister of Healthcare, Alexander Kvitashvili, to introduce the position of the ministry about these draft laws. Please. Good afternoon. I will not speak for long. Once again, I will try to dismiss those myths that associated with our package of draft laws prepared by the big number of people, a group of people, and they passed all expertise discussions. They were agreed with World Bank, with IMF, and with World Organization, Healthcare Organization, etc., etc. The most important what I want to say, these are not a draft laws about privatization, about selling some property, quite the opposite. These are improvement of networks of we have in Ukraine, which must change. It should be more autonomous. It should make money legally for us to finance the system correctly, and to finance services, not beds. For the state to be able to pay for healthcare services for population. Yesterday and today, I looked at alternative law, so-called registered in the parliament, and alternative to this package. I want to tell you there is no alternative. That is 95% of our task. Amendments are not important, but there are some critical. Again, I would like to ask those MPs who registered the law just to sit down and to discuss and to work with us, because strong no big difference for us not to waste time. We lost a lot of time. I would like to ask to invite to work with our team that worked on those draft laws, and we can find a consensus, and we can have one draft law for easier vote, and all the rest of the amendments in the alternative law, those are the form of ownership, and for private enterprise to be not to have their stake. I agree with that, and what to hold accounts, and in which banks we agree that it's better to have accounts and a stake in state-owned banks. So there are some elements differences that don't have a serious influence on reforms, but there are some issues that can make the process longer. So that's why I would like to make it better, to exclude political issues. I'm ready to sit down with the group that worked on the alternative draft law, to have one normal, good document, and that's the conclusion we received from expert group in the parliament, that law, alternative law, and we are ready to accept all the comments. So I ask all to move to a constructive approach, and let's work together. And I'm sure that in a couple of days, and we don't need more time, we can come out with one draft law. Please, time. Could you speak about how important it is to pass that law now? Very important. It's a pity that we lost time. We're not able to bring it to the parliament on Friday. Why? Because new budget year begins, and we need to to calculate our budget for the next year correctly. That's very important. And in 1 day and 2 months, you cannot change the system. We need a transition period, a year plus minus 2 months, and we need to begin now. So by the middle of the next year, the country to be ready for new system to finance and to everything. But without, if we don't begin, we won't be able to make it, because by the end of the year we would like to start working on social insurance schemes, and thinking that we would have a lot of information and statistics and all the rest what we need to build the system correctly. So that's very important. We should be quick and passionate and ready to work with all. Forgetting about everything, just to sit down and to have a very good draft law. I would like to invite, thank you, Minister. I would like to invite Kostyantyn Yarynych, MP, a member of the Committee on Healthcare in the Parliament, and about the situation in the committee, how the committee is ready to speed up the work on these 3 draft laws. Good afternoon. I don't know the answer to this question, how ready we are ready to approve these draft laws. Those I would like to have to start with something different, because I wanted to speak about, not on behalf of MP. I'm someone who is in surgery room, and I'm the one who for many years was running the biggest oncological hospitals in Ukraine. So I know what people want. Not from a political point of view, but everywhere, what we want, what doctors want. The situation is that during the reforms and the pseudo-reforms that we had, we didn't see a reform. So when we came to that threshold, and the process of reforms begins, we were trying to implement them and to bring in, at least, not us, but the cabinet of ministers, with active participation Minister of Healthcare. When we saw the resistance. Resistance was not clear to me. I don't know the answer to all the questions, but nevertheless, I wanted to not analyze political issues, or maybe no interest in the reforms. I would like to say something different. We should not criticize the draft law, which has not come to the Committee of Healthcare. For us, for correct distance, we should listen to all views, to all the points in the draft law. We didn't work in the committee. The other draft law came, maybe. I have an idea about that alternative draft law. I can tell you that my opinion, and that all those comments, they could be corrected in the committee. There are some amendments, some differences. Please, let's discuss and let's come to the common opinion. Now, the situation is as follows. We lost, I believe, about 2 or 3 months. But for us not to lose these draft laws, I will initiate the meeting of the Committee on Healthcare. It can be extraordinary, ad hoc, and I would like us to, if it's necessary, we should have a round table after this. Of the main, which is 2109, an alternative. Our task is not to bring to the Parliament several draft laws and to confuse MPs. We don't speak about the worse or better draft law. We said that in these draft laws there are some serious initiatives and to reform healthcare. If we can bring these draft laws together and change it and bring it in a way that as one draft law, it doesn't it's not principle for me as a doctor. The ownership is not important. From healthcare, has the same position. It's important to launch the process, and that those reforms we plan today, for them not to stop. And I would like to take to take out all those human personal differences which are there. There are probably some deadlocks in the development of any draft law. That's where we are. We should get out of that as soon as possible, and I'm ready to constructive cooperation. And I, at the committee, and we wanted. I was standing for a listener to the Minister of Health. It didn't happen. I wanted us to continue our session, and but MPs refused to vote for more work, and I suggested to have a meeting in the committee in the morning. There was no quorum, so probably not everything is so easy, and not everything in the field of Ministry of Healthcare. This last week, it was important for medical community because many people knowing about such draft laws, and we expected that during the summer we would prepare many difficult, painful things for our healthcare system now. As I understand, that we have still, we can finish the work on this draft law. Maybe in the committee we will, in ad hoc committee meeting, we have a hearing. Or if there is any one more session, I will initiate that issue and to the administration of the president, to the cabinet ministers, to this leadership of the party. Those are priority laws to consider a decision of the parliament in the summer. Thank you. Thank you. I wanted to give the floor to experts and independent who don't participate in decisions in the parliament, as Chernenko, who is the main expert of reanimation package of reform, about the importance of these draft laws for healthcare reform and the attitude of doctors community to this. Thank you very much. Good afternoon. It's not the first time we have these discussions around these initiatives and draft laws. Some points to underline, to understand what is happening. And the initiatives from the ministry are not new for Ukraine. In 1995, there were first experiments in 2005. There were as a part of EU. Nothing new, nothing. But it can be done in the framework of Ukrainian legislation, but local authorities, we know the process of decentralization which initiated, and they wanted to strengthen. They didn't use that chance. This is the first step. We have to motivate local authorities. Also, next part of work in the ministry, and not only, but in the cabinet of ministers and in the parliament. First and key point. After these amendments or changes, they will take place, and the guaranteed volume of all, that's a key point, and services and other procedures. And without that step, we will have just such a thing when we will create an opportunity, especially about politicians. They don't understand, and they put it on all the population, the same misunderstanding. The majority of problems in the Ministry of Healthcare are on local authorities, and are their owners. They can change their form, they can reform it, or they whatever, postpone. Everybody believes that that is done in Kiev, and that's where they should go. And these laws, and in the aspect of decentralization, on one hand, from the health care side, they put it in its context, and everything with healthcare access to doctors. That's what you deal with local authorities, and in the context of decentralization, this is what announced by the government. Those are the steps we cannot work without them, but. I would like us to consider these laws, draft laws from the position, basic principle in the law in general, the ownership law. The local authorities are owners, and they decide on the form in which banks they place accounts, open accounts, how they organize. We in Kiev, we in the center, local authorities. We should not limit the opportunities, and creation of some conditions of how to do it. It's not in key. We have politics and the creation of opportunities, but the support and strength and stimulation, motivation, and these are also from motivation of owners during last 20 years. We should respect the owners of our hospitals, but we should not tell them what they should shouldn't do quickly. One more point, because the minister, as the way minister says that the hospital should make money. What does it mean? That our patients go abroad. It is called medical tourism. It is a lot of our doctors and a lot of hospitals has a big policy for tourists who come. And we have a lot of ways to make money. Our doctors will improve qualification in the hospitals, and we receive that fund that the state cannot provide. And is that earning? And insurance companies, it's a very small package of medical services. They don't know how to organize that. They don't know how to approach our public hospitals to sign a contract for insurance of medical services. It's not normal. Everybody dreams about healthcare insurance, but we cannot create conditions for that business. That is nonsense, which is resulted by these small changes and freedoms. And finally, I liked Serhiy when he expressed his opinion about these people. They don't are not afraid of privatization, but they're afraid that doctors will not have opportunity to grow, to develop, and to have normal salary. When patients will not have a chance to choose hospitals and to get that quality of assistance and also medicine that should be paid by the state. They all signed, all political parties fractions to sign those things and reforms, but it doesn't mean that we stop with this.
Thank you, Zoryana. I would like to ask Vyacheslav Polyasnyi in order to express the position of the regions. Vyacheslav is the head of the Department of Healthcare of the Odessa State Administration. He is actually well acquainted with the situation there and the needs of the medical institutions. Thank you. Good afternoon. Perhaps today, as never before, I already mentioned that the level of preparedness of the medical community and in our region, among those, is such that today the medical officers are absolutely prepared to implement those laws which were adopted. The society is also ready for that. And this level of preparedness, if it's not being implemented today, if not the draft law, some compromise decisions are not adopted, in fact, this will just gross out all the expectations among the professionals, which is very dangerous. On the other hand, switching over to new relations after the adoption of new reforms, decentralization, it will be impossible for a free choice for our citizens to choose the medical institutions they like. They are not going to implement the democratic principle when the money follows the patient. Again, this will set us back for decades, And I do agree with the minister. We do not have any time at all, because to bring the network of the medical institutions to a new system of payment, or they're providing more high-quality medical product. And if we do not do that within the next 6 months, next year, the medicine will catastrophically lag behind those changes which have been outlined, and this will be a regression for the whole region. This can bring to the complete, collapse of the medical institutions or medical assistance. Medical officers are not afraid of that. They want to honestly work, to be paid honest money, to pay taxes, to receive the visas and be full-fledged citizens. Medical officers today are very mobile. They're constantly in contact with their Western colleagues, but they're very much ashamed to invite those colleagues from abroad to their institutions, because sometimes they were dangerous, hazardous to the health and life of our patients. I mean, the condition there. So if in the nearest future we do not adopt the package of laws, maybe those subtleties which reflect the opportunities subject to economic system, this will be the element of the humanitarian catastrophe. Thank you. Before we switch over to Q&A, we have the last comment of the Maxim Ionov, representative of Public Council of the Ministry of Health, in order to have the whole gamut, so to say, of different ideas regarding those laws. Good afternoon. Thank you very much for the opportunity given to me to speak here. I would like to say that me too, every day I receive a huge number of, let's say, of the addresses of the professional medics who and others who are striving for changes, reforms, and they really request this process to not to stop this process. If you stop this process, this will spell our defeat, and we cannot allow that. Also, I would like to say that that we do appreciate the efforts of the minister to try and find the constructive dialogue and to make the work constructive, and also to follow the way towards which would be useful to the system of healthcare, patients, and the state as a whole. I would like to say that once we entertained the idea to establish a center of reforms, operate in a committee of the Verkhovna Rada on the issues of healthcare. But as we can see in the turmoil of the latest events, there is a doubtful position that the committee itself has to exercise control over implementing the reforms and follow up this process. Moreover, I can say that I am positive that the public and the public council as the mouthpiece of the community and the public agency has to demand from the committee and the Minister of Health and the cabinet ministers and the MPs, and they have to demand the constructive progress of the reforms implementation. So I would like to propose, referring to the words of Mr. Kvitashvili, I would like to suggest that the public council under the Ministry of Health should be kind of open platform or mouthpiece of, for all the proposals which we receive from the regions, with involvement of the top-notch experts who every day send in their proposals, and indeed they would like to launch an efficient and a proper reform in the health care system. So we are going to cooperate. We are open to everybody. We invite and involve not only members of the public council. We are not closed. We are open to experts and doctors, physicians, all those who would like to change our country for the better. Thank you, Maxim. I believe we have several minutes for the questions. If anybody has any questions to the speakers, please ask those. Oksana Betnitska, I have a question to Mr. Kvitashvili. Will you please tell me, if my memory doesn't fail me, they planned a pilot project for the reform of the sphere of the healthcare, which you present with Mr. Radutsky and the others. Is there any news that will your experience allow you to apply this experience in other regions in Ukraine? Kyiv is also actually part of Ukraine, so whatever happens in Kyiv, so this package will not allow to start to any region to become first or second. Kyiv shows more preparedness for that because they have a group of specialists who have been working on that project. Not that we would like to to start. We want the Kyiv to make locomotive of these reforms, but until we have the laws adopted, we are in the areas today, not in the avant-garde. So Kiev has the biggest opportunities to start working according to the plan which we proposed in due time. But speaking in principle, in our other regions which I visited, they have the same level of preparedness. When I visited the Odessa region, all over the Ukraine, they are prepared to that. So when the law is adopted, this process will start in different regions. Mr. Minister, will you please tell me, in your opinion, why there is such a resistance in the parliament? Why they do not want to find the common decision? I mean, the MPs, the people's deputies, taking into consideration the events which took place over the last few weeks, whether some threats or whatever. Why this delay? Well, I mentioned that yesterday. Once again, I can repeat that when we went to the meeting of the Committee for Health Care, there were no indication that there will be some kind of resistance. I was at the meeting of the committee the day before, and the discussion was highly professional without any journalists or cameras. Everybody were working. I presented my proposals regarding the laws. There were quite a number of questions. I tried to answer all those. I heard some remarks and comments. We had the findings of the expert center for the Committee of Health Care, what they would like to change. We discussed all those issues, and we're coming to the meeting of that committee. 90% we agreed with those amendments or alterations that they proposed. So there's nothing special. I can just raise my hand and say, whatever you wrote is acceptable. Let's introduce those amendments to discuss everything. If I'm not mistaken, there was 8 items, 7 conditional speaking, 7 were completely adopted. There was only the one item which was discussed for 5 minutes. So the whole discussion could take about half an hour, not more. But in fact, we did not reach the discussion. We were talking about anything but about the laws. And many of those who were present there, they witnessed that process. I cannot name many reasons for that. I don't know why it happens in this way. I do not want to come back to that situation, but everybody had an opportunity to prepare any draft laws, because the deputies have the direct right to propose any initiative in the session room. So if everything were prepared already, they could do that 2 months ago, and not to write something or to voice their claims that I did not propose some of the draft laws which were written before. They could do that themselves. I don't know. Let's forget about that and try during this week, use this week for maximum constructive work and bring this process to the logical end. Can you clarify who is the author of the alternative draft law? And during last conference, you said that was not ready yet, and it will take 10 more days for its being ready. So has it been submitted to Verkhovna Rada or not? It has been registered. We took from there the text. When you rewrite 97% of the text, the text is not necessary. But technically, according to the law, we have the right for during 10 days to submit the draft law. But I mentioned there were some changes, 4 or 5 items which were included in the alternative draft law, or the package. The author is, as far as I know, Deputy Musi. I don't know who were the co-authors, but at least one author was Mr. Musi. Aren't you surprised that the same day when you submitted your draft law, when the committees received the draft laws, the information appeared for the first time that there is alternative draft law the same day? Because before that, for 10 months, Musi was the Minister of Health. Then for some period of time, 4 months, and then your guidance is over the last 6 months. And suddenly, during the same day, a lot of different proposals for the committee to consider that. Well, yes, I was really much surprised by that fact because, first of all, the law, draft law, alternative draft law, which came to the surface, all those changes or amendments could be introduced during our discussion. First of all. Second of all, Mr. Musi had such a legislative plan in his hand, he could come any moment because any deputy who would like to meet me, they come to and meet with me, you know. We were working on this kind of reform. When they asked me and they intended on that and they requested those packages, so all of a sudden everything is ready and then appears something different. At the meeting of the committee, what was interesting that we did not discuss the submitted draft laws because we discussed the possibility of the deputies to submit an alternative one. So at that moment there was nothing at all. The alternative package emerged, as I'm not mistaken, 2 days later. That was a strange situation, but let's hope that we are not going to have another surprise like that. So thank you very much, Mr. Minister. Sum up, we are talking about the basic reform. This is the issue of the organizational legal form. This is not the issue associated with privatization and anything. All those sensitive issues will be discussed later in order for us to establish normal budgetary relations and for us to organize medicine in a normal way. We have to adopt those short, very dull, I would say, draft laws because those draft laws do not contain any sensations. You're going to see the alternative text, even sometimes can talk about some antagonism, but they are not there. There is no conflict related to those issues. The issues are absolutely technical. We have to depart from the procedural elements associated with the regulations of the Verkhovna Rada and to focus upon the finalization, the final adoption or approval of this package. We can see a good example when the observation of the procedures and regulation of the Verkhovna Rada can actually lead to a delay and abuse of the rights when, on the contrary, for the common good, we have to, as soon as possible, adopt those or approve those laws or draft laws. In the media center of reforms, we have to emphasize that the process of reforms must pass in a very concerted way. And we see that the experts and representatives of the MPs, and others support this decision. There are no discussion, no sensations. There is a broad consensus in the quarterly when we are talking about adoption of the state and decision in different institutions. We have to accelerate as much as possible our work, and I believe that by pulling our efforts to the help of our public at large, we'll achieve the approval of those laws, and then we can actually talk with you about its implementation. Thank you very much. Our next briefing in 20 minutes, which is dedicated to Euro integration of Ukraine. Thank you.